welcome back to my channel. So I'm Rebecca Sechere, or Becky Sechere in short, and in today's video, as you know, I'm a UK registered nurse and I give tips and advice to overseas nurses living and working in the UK, and I hope these tips and advice would help you in your career as a nurse whilst you relocate to the UK. So the topic for today is 10 qualities of a good nurse. Am I a good nurse? I believe so, and I believe most of you are good nurses as well. So the first on my list is good communication. So as a nurse, you should be able to communicate with your patients in a way they understand, and also you should be able to understand your patients. As you know, communication comes in different ways. We have written, we have facial expression, non-verbal and verbal communications as well. I'll give an example of communication. So back home, when I'm telling someone, so I'm going to be making some gestures and I'm saying or explaining numbers to somebody. To say the number 2, I'll do like this. That is in my culture. But in UK, if you do this, someone can perceive that as being rude, or it's a rude gesture. So you need to know some of these little things. So a friend of mine said she was explaining to a patient about medication, and she says, take 2 3 times a day. And the patient just broke down, became very emotional because she felt the nurse was being rude to her. And the nurse became surprised and thought, oh, I'm just trying to explain, so you need to be careful. I did a video on English expressions and what they mean in clinical setting. You should look for that video. It would give you a lot of tips about certain words that they use that we from our home country, we don't know. The next one is critical thinking. So as a nurse, you have to be thinking very quick, thinking out of the box. You need to be troubleshooting when you are assessing a patient and getting the information patients are giving to you. You should possess problem solving skills as well. So that's another one. The third one, of course, you have to be caring. The fourth, you should have stamina, because sometimes you go to work, you have 12-hour shifts, you're on your feet most of the time. So you do need to have stamina. Sometimes you want to go to the toilet, but you're doing something, you tell yourself, I'll go after I finish this, and you keep holding it. It is not good for our health. So, you need to have stamina. Another one is the fourth on my list. No, this is the fifth, is to be empathetic. As a nurse, you have to empathize with your patients. Number 6 is you have to be compassionate. You need to be compassionate. You need to show compassion when you're looking after your patients. The next one is competence. This is very important. Competence. If you are not competent in something, always make sure you seek advice. Always make sure you feel confident and competent in something before you do that. Do not be forced to do something you feel you are not competent in doing. Seek help so that you can get trained before you can perform such a role if you do not feel competent. Otherwise, you may find yourself in trouble, or next moment you're being referred to the NMC for being incompetent in what you do. Another one is ability to handle stressful situations or difficult situations, and also be able to handle stress as well as emotions. Stress can be from your work, stress can be from your manager, stress can be from your colleagues you work with, and stress and emotions can be from your patients or families. Sometimes some patients can be very challenging. Sometimes some families can be very challenging. And sometimes the job itself can be very challenging. And the situation you're dealing with can be emotional and challenging. And as a nurse, you should be ready, or you should have the ability to handle such situations. And if you're struggling, always remember you need to speak to somebody, be it your manager, be it human resources, or whoever you feel is appropriate, or speak to a friend. Don't sit down and struggle or suffer on your own, because nursing, especially in the UK, because I practice here and I practice in Ghana before coming here, it's completely different. It's a different ball game. People will complain very easily and the situation would be escalated if you're not careful. Back home, it is not like that, not as but it's a different country. That is how they do things. There's a lot of accountability, so you always have to be careful what you do as a nurse in the UK. The 9th one is willingness to learn as well. You should be willing to learn every time. There is the opportunity for you to learn. There is the opportunity if you learn to progress, if you seek the progression. Sometimes you would meet difficulties, sometimes there would be stumbling blocks, but you shouldn't let those things stop you in whatever you want to do. So show the willingness to learn and you get the support. If you're working at a place where you feel you are not being helped or supported to learn, you should find somewhere else where hopefully you will get that support and ability to learn. The last one is time management. So if you're supposed to get to work at 8 o'clock, actually, at least you should arrive by 7:45 or 7:50. You have to leave home early. There is no room for, being late to work. Apart from that, your responsibilities at work as well. Some of us seeing patients, I give treatment for patient for a particular condition, and I'm given 25 minutes to do an injection, do consultation, and do my letters at the same time. So if you're not careful and I don't work within that 25 minutes per patient, I would be running behind and patients would be waiting. So these are some of the things. If you're supposed to give medication on a shift and it is done within a particular time limit, you have to just make sure you are working within a limit so that you're not delaying patients, families, and if you tell someone I'm going to call you back in 10 minutes, make sure it is within the 10 minutes. Or if it is beyond because of something has happened, you must be able to apologize and say, I'm sorry, I was supposed to, but so there's a lot to know about nursing, especially here in the UK. I hope this video has been helpful, and take care of yourselves. If you have any questions, if there's anything you want to know and anything in nursing about nursing in the UK you want me to talk about, please feel free to drop that in the comment section and I'll try my best to do just that. Anyway, take care of yourselves and I shall see you again soon. Bye bye.